Welcome back to the Soul House Yoga Retreat YouTube channel. I am Donna Amrita Davidge here today to talk to you a little bit about prenatal yoga. So I often say if you have any questions, please reach out to me. And I've had a couple recently. So the first thing I'm going to address on this one, and that is someone I know who practiced yoga with me when she was 11 years old. And now she's 25 and in her third pregnancy. And she reached out to me and doesn't really do yoga anymore. She's raising her children, but she is experiencing some pelvic discomfort in her hips and lower back, and also asked about some rib stretches and maybe some breathing for pain and breathing for during delivery. So I'm kind of thinking about all those things. And the first thing I want to say is that in pregnancy in general, if you're already doing yoga, you probably have a little bit of a better idea of what to do with the poses and what your body can do. There are, however, still some guidelines. And that is that deep twists are to be avoided, though mild twists can be nice. They stretch the rib cage actually. And of course, laying on your belly is to be avoided. The first trimester, you may not really see much or feel much, and probably talk to a prenatal specialist about those things, but those are pretty much the guidelines. And also to lie on your left side. So when you're resting at the end of your practice, perhaps it's better to be on your left side, and even when you're sleeping at night, to be on your left side. So that said, what I really want to address today is not pregnancy in general, but the question that Sierra had for me about the discomfort that she's having and how do you address that discomfort? So first of all, when you do your stretches in prenatal, for the first 3 months, it peaks at the end of the first trimester, you have a hormone called relaxin, which may help you to stretch more. That's what it's meant for, so you can open up to have the baby. And so you have to be very mindful that if you can stretch more than normal, don't fall into that too much. And in general, as you do these stretches, it's not a competition. This is a way to help your ligaments, help your muscles, even help the hips as they expand during the pregnancy, which starts to happen, that part and the expansion of the uterus, in about the second trimester. Okay, so right now I looked at the months when I asked Sierra where she was, and I think she has about 4 months left to her pregnancy. So she's about 5 months in it. So she's past her peak of her relaxin, that hormone. And she is in the phase where the uterus is growing and the hips are expanding, as that might be creating some of the discomfort. So first and foremost, I want to say that stress reduction is really important. And one of the most important things you can do for stress reduction, and I say it time and time again, but so many people I know that exercise or think they're taking care of themselves, when you say breathe, they just don't think really that specifically about it. So I looked up Lamaze breathing because I know that really helps people. And interestingly enough, that didn't seem even that specific about how to breathe. So in yoga, we breathe through the nose. That said, when you're all the way at the point of labor, there were no specifics as to how to breathe. If you feel better going and breathing through your mouth, great. If you feel better breathing in through your nose and out through your mouth, great. In yoga, however, we are going to work towards breathing in and out through the nose. So as we go through these poses today, I want to invite you to breathe through your nose. Also, this truly does help you relax. So if you're having this pain and then you start to tighten into the pain or kind of, not get stressed with the pain, it's much more useful to breathe through your nose then. So here's the yogi breathing. In and out through the nose, into the belly. And oftentimes I've even seen yoga teachers do this. Well-known yoga teachers go, and so this is definitely something you want to not do. The shoulders will not go up. Deep breathing is not up here. Deep breathing is down here. And breathing through the nose helps you deep breathe. So I don't want to belabor that too much, but I do want you to remember to do that and to practice it. Okay, so the first thing that we're going to do here is something called cat-cows. I also know a woman who used cat-cows while she was in labor. And so this is really an individual thing, but depending on where and how you're going through your labor, there are some techniques that I've heard over the years of women using, and cat-cow, believe it or not, is one of them. So you can use it while you're going through your pregnancy, great idea. And if you want to be able to do that during the delivery, give it a try. I've also known women that do this in water if they're around water, but everyone has their own way. And I'm not at all a doula or a pregnancy delivery specialist at all. I'm just a yogi who's sharing what I know. So I'm going to put my hair up for cat cow, and then we're going to come on to all fours. You're going to spread your fingers wide. Your knees will be under your hips. And really all this is about what's comfortable. So depending on how far you are in your pregnancy, you might want to open your legs a little wider. So basically for this, what we want to feel is that we're moving the pelvis, that we're loosening the ligaments a little bit and moving the spine, okay? So as you breathe in through your nose, just go ahead and look up and drop your belly. And of course, I am not pregnant, so my belly is not dropping as much as a pregnant lady's might show, but there's your inhale. On your exhale, just let your spine come up and cave in. I'm going to do that a few more times. Inhale. The main thing here, you want to feel the movement of the pelvis for the pregnant lady. And then exhale, reverse. One more time, drop your pelvis and your belly and lift your heart and your throat. Inhale through the nose. And as you exhale, release that. Come back to center. Another thing in my research that I found that was often offered and recommended is to bring your leg up in the air and to just extend so you get a stretch of the ligament and the muscles going in to the hips. And then you can extend an arm out at the same time and create a really nice stretch and keep your belly engaged as much as you can. Just don't overdo anything and breathe. And then take that down. And of course, you're going to do the other side. So stretch the other leg back and stretch the arm out. Now, some of the things I saw when I was researching were same arm, same leg, but I think the opposite one balances better. So you can experiment with that if you like. Another one that you see a lot for pregnancy is child's pose. So again, you might have to open your knees a little bit wider. You're going to sit down. Now, this really softens your pelvis. And you're going to just let your belly drop. And you're going to relax the head, neck, and shoulders. And you're going to stay here and just breathe through the nose and stay here as long as it feels good. Okay, I am going to come up so I can show a couple more things. So we're going to inhale and come up. And then we're going to exhale. Another good hip opener for pregnancy is to have the soles of your feet together. You do not have to bring it way in if that doesn't feel good. But if that does feel okay, you could bring it in a little bit. And then you want to just lift up and just to soften this area again. We're not going for a big stretch. You can just inhale and then exhale, lean forward a little bit. Doesn't have to be a lot. I'm really feeling that stretch already. Inhale and then exhale, bring it forward. Good. And then inhale, let's do it one more time, and exhale, bring it forward. Good. Now, another thing that is good is to do a modified sun salute. And this is where you might get a nice rib cage stretch because we're going to stretch up. Another thing that helps stretch the rib cage is to twist. So we'll do a mild twist after we look at these sun salutes. And I'm going to get a little bit cut off. So you usually want to start out standing up in your sun salute. And so we're going to stand up. And then I'm going to fold over and you'll see me again. And you can have your knees bent and just fold over, right? And then you're going to go ahead and just step back and have the right knee on the floor. And again, my upper body's going to a little bit cut off, but I'm not going to change the angle. I'm just going to come up like this and I'm going to reach my arms up. You saw me reaching my arms up. So now you still see my rib cage. This is stretching the rib cage. And you want to feel that stretch. This will also help you breathe more deeply, stretching the rib cage. Good. And then you're going to take that down, and then we are going to go to downward facing dog. So spread your fingers wide. Now, depending on where you are in your pregnancy or just in general, a down dog does not have to be a very wide stance in your body. So going from all fours, actually, this is a nice stance right here. I'd imagine it's not too wide, especially if you're pregnant and quite pregnant, right? You're lifting the weight up, and you're just going to let that relax. And you're going to let your head go and your knees can stay a little bit bent and you're just going to stretch and breathe through the nose. And then you're going to gently drop the knees back down and you'll step the other foot forward and then you'll reach up again and you'll stretch the rib cage, breathe. All that breathing is through the nose and then you'll take it down. Good. And then to finish up, you'll just step it forward, fold over again. And then inhale, come up and exhale. All right, I'd like to show a little twist. And again, the twist can be useful. So if you can sit cross-legged and do this, this is also going to help open those hips a little bit. If this doesn't feel good to sit cross-legged, you could do this one alternately with your legs out in front and just bring one leg up, which by the way is also a little hip stretcher. And that's really something you want to stretch a lot in pregnancy, right? Is the hips. Okay, so we're going to just do a nice little side twist. Now, the deeper twists you want to avoid in pregnancy. This is a mild twist. I'm feeling my rib cage. As a matter of fact, my twist is from my waist. I'm not twisting from the low back because we want to be good to our lower back in life, but also in pregnancy. So do not over twist from your lower back. Twist from your waist. Feel your rib cage is moving around. Breathe, look back. Come back to center. And of course, you want to do both sides. So inhale and come around. And again, breathe. Feel your rib cage is stretching. Good. And then come back to center. Now, there's one other thing that I thought about. Probably there's others I'm missing, but hopefully this will be helpful. The other question that she had was about breathing for delivery. So when you're in delivery and you're going through labor pains, in Kundalini Yoga, there is a whole aspect for pregnancy. And the aspect really with Kundalini, which is so different than other forms of yoga, what I just showed you was classic yoga. It's all really very good, is to create situations in your body where you feel discomfort, even pain, and just learn how to breathe through it. Because that's basically what we're talking about. And when I looked at the Lamaze, because I'd heard about that, and in yoga too, and in life, that the breath is something, it's not just distraction, because one of the things was saying it's sort of a distraction. It's much more than that. It's an extremely powerful tool that will help you get through the pain. It truly, truly will. So one thing that you can do is just bring your arms out for a while. This is up to you. You want to do this until the discomfort builds up. The discomfort can even build up to the point of feeling pain. For me, I usually would feel it in my shoulders and deltoids when I would do this for a while. And so this is something you could work on. And it just really helps us to remember that we can breathe through the pain and it will help. And again, as I said in the beginning of this clip, how you breathe when you're in labor, just listen to yourself, right? If you feel like inhale nose, exhale mouth, if you feel like and that's going to help you. You don't want to pass out, of course, but I think your body really has its own wisdom there. So for those of you out there that are prenatal and having some discomfort, I hope that these stretches will help you, and good luck. Have a great day and hope all goes well. Namaste.